I am a co-founder. Hi, my name is Kennedy. I am co-founder at Afyakit, which is a health tech startup based out of Nairobi and we specifically look to help health facilities do better care quality, better care management, essentially. The problem we're specifically looking to address at this point is a lack of actionable data for decision making for health managers in Sub-Saharan Africa. Earlier this year, we did a survey which basically showed that about almost just over 50% of health managers in East Africa really struggle to take information or data from the health facilities and use it in decision making because it's probably in a form which is not being processed enough to basically essentially help them in making the decision they need to make. And so what we have done essentially is come up with a technology solution which houses two things. The first thing is assessment tools. We basically collect a lot of data, and then the other thing is and the other portion of it is a component that really takes these data points and processes them into very easy to understand indicators that health managers can then use to make the decisions that they need to make. What do I mean by this? Essentially, for example, we have a tool which basically is able to assess the quality of maternal care offered at a health facility. What this tool does is that it collects over 300 data points from a health facility, and then on the back end, basically computes an composite indicator that a health facility manager can very quickly then use or at least understand and basically guide their reasoning behind where they should allocate resources or what they should use essentially for what direction they should take as far as the management of the facility. Of the past year, we would actually worked with nine hospitals in Nairobi, most of them all the way from local, very small dispensaries to essentially referral hospitals within the city. And it's been really, really interesting just talking to them. And some of the interesting stuff that we're seeing also is that the rate of, let's say, number of women that have been able to come through the facilities and also being able to get adequate care has actually gone up. For instance, one of the facilities we actually worked in, when we started working with them, they did not have, when we did our test with them, collecting over these 300 data points regarding the delivery of maternal care in that facility, they actually scored very poorly on one of the indicators, the capacity to essentially perform neonatal resuscitation, which basically means if you have a child who is non-responsive, could you revive them? After basically using our tool, right now as we speak, they've been able to completely implement changes in their management. They've essentially acquired new infrastructure that have RAS data within the hospital. And also just on a composite level, we realize in all the facilities we have right now, there's a shift towards more comprehensive care. Now women are actually able to get correct monitoring as they are delivering, and also just training as well. We have testimonials of health facilities actually now are able to offer training for continuous education training for the staff because of the indicators that they're getting from our tools regarding the different deficiencies in terms of competencies. So that's what we've been able to do the last few years, and you're really looking forward to essentially grow as part of the Global Good Fund. Thank you.